Hi, it's Erin from Therapy Care. Today I'm going to be talking about pacifier use since I get questions about this a lot from my patients and also from my own friends and family. And I found that a lot of them are kind of shocked by my answer. So to start off, I won't deny that pacifiers can be an awesome tool to use with babies. I personally used one with my daughter, which was a sanity saver for me and my husband during those early months when she was really colicky, and it was the only thing that seemed to soothe her at times. But the big question is, when should pacifiers be taken away? The American Academy of Pediatrics recommends pacifier use up to 6 months at sleep times to help reduce the risk of SIDS. They don't encourage it after the age of 1 since they have found some correlation between middle ear infections as well as dental issues. So from a speech pathologist's point of view, my recommendation is to wean baby off of the pacifier during awake times by 6 months old, meaning it's still okay to give pacifier during naps and for nighttime sleep at this point. And that's usually when I get a shocked look from people, most likely because 6 months old seems so soon. And so it's so common for us to see even toddlers walking around with a pacifier in their mouth. But let me explain the rationale behind it. So 6 months is when babies are really starting to experiment with their voice and babbling and trying out new sounds with their mouth. And the pacifier, if the pacifier is in their mouth, they're just not getting the same feedback they need to develop those skills because something is in the way. So having a pacifier in during the day past 6 months can start to inhibit your baby's ability to develop babbling, which is the essential precursor to saying words. So this can be detrimental to their speech and language. So sometimes we see, the toddler who has the pacifier in their mouth and they are trying to talk around the pacifier. And this can really cause speech issues as well because something is in the way, which encourages improper placement and improper movement of the tongue and lips when articulating certain speech sounds. So if a baby or toddler is practicing talking with something constantly in their mouth, they are going to learn inaccurate pronunciations of speech sounds. And the other thing worth mentioning is the impact on dentition that pacifiers or any sucking habit such as thumb sucking can have. When a child has a pacifier or sucks their thumb for a prolonged period, they can develop what's called an open bite. And you'll notice when they bite down, the top and bottom rows of teeth in the front don't come together like they should, and there's a little opening that the pacifier or the thumb has created. And a dental abnormality like this can also cause speech issues. For instance, an open bite can cause imprecise articulation of an S sound because the tongue may tend to protrude through the hole between the upper and lower teeth when speaking. So yes, even though it can be a daunting process to wean your baby from a pacifier, it's really important to get that started sooner than later because in general, it is much easier to wean a 6-month-old than it is a 1 or 2 year old when their attachment to the pacifier will be even stronger. So if you have any questions about your child's speech or language development, you can contact me at ejackson@therapycare.com, or you can call Therapy Care at 630-761-0900. Thank you for listening.